Hi, I'm Andrew Kennedy. I'm a physician at the Sarah Cannon Research Institute. I'm Director of Radiation Oncology and Director of Radiation Oncology Research there. So radiation oncology is a type of anti-cancer therapy that uses invisible radiation, much like you would see from a light bulb, although the wavelength of the radiation is so small that you can't see it with the human eye. But the radiation affects tumor cells in a way that causes them to die. Now, it can damage normal liver and normal stomach and breast and lung tissues. However, we are very careful to direct the radiation only to the tumor as best we can. So radiation is a way of killing cancer cells without the need to remove it from the body. Radiation therapy has evolved to use a variety of different methods of killing cancer cells. Early on in its experience in the early 1900s, we would physically take radioactive sources and place them either in a tumor or on a tumor. And that has been known as brachytherapy. Nowadays, we use that approach still in prostate cancer, cervical cancer, head and neck cancer, and breast cancer. An alternate way, and what most people think of as radiation therapy, is a machine that directs a beam through the patient from the outside. And that is generated by a machine that uses electricity, generates the radiation, and that is projected through the body. Now, the patient is not radioactive after receiving the external form of radiation. However, in some forms of radiation that we put in the body, there are some precautions that need to be taken because the radiation is still in the person. And that's just limited to brachytherapy. So, of all the cancer types that we deal with on a daily basis, nearly all of them respond very well to radiation in some form. It isn't so much that the tumors wouldn't respond to radiation, why we might not use it for that particular cancer, is that in the context of using chemotherapy and surgery, sometimes radiation is not needed for that particular tumor. However, most common tumors respond very well to radiation, and therefore radiation therapy is an integral part of management. For instance, cancers of the lung, breast, brain, also gynecologic cancers, endometrial and cervical cancer, and of course stomach, pancreas, colon and rectal cancers, where radiation is a mainstay of therapy. So all tumors that are solid, which I just named, would respond well to radiation. Now, there are some other tumors which we call blood-borne tumors, such as lymphoma and leukemia, where we use radiation less often, not because it doesn't work very well. In fact, those tumors are very sensitive to radiation, but we have limits on how much of the body we can use radiation to at any one time, and so therefore chemotherapy often takes the lead in treating those tumors.